Hopkins has got collaborations throughout the world in over 100 countries. We have more than 400 faculty and students throughout these countries in the world. And so we have a very large global footprint, the largest global footprint of any university in the world, and that's really been a major part of our mission. And so we have strong linkages to the local communities and to the leadership in many of these countries that allows us to roll some of these programs out very effectively, very efficiently. And that's really, I think, not only a responsibility for Hopkins, but a great opportunity as well.
Johns Hopkins and Makerere University have a long history of collaborating together, both in the field of research, training, and service provision. We have a number of collaborations that have produced landmark research programs. For example, the School of Medicine of Johns Hopkins have been working with Makerere University, and they produced some of the very interesting studies on mother-to-child transmission prevention with nevirapine.
I work as an international coordinator, and my job is to come. I'm stationed at Hopkins, but I do come on the site field every quarter for between 4 to 6 weeks, and I help with training and operational, studying the projects here and getting the ground and implement what we have designed as a scientist or what we have designed as a programmer to bring it up into the field.
What I find very exciting is that the collaboration has initially started as single disciplines, but now I see the collaboration moving across discipline, being interdisciplinary, and across the Johns Hopkins medical institutions, which actually is very exciting in terms of leveraging all this discipline to bear on the problems we have at hand.
The idea isn't to go and implement what we think is the best way, it's to go and work within the community. When you think about what Dr. Bollinger has done, is that this training, this education, people need education, and they can't get it by coming to the US all the time. It's very expensive, the visa and all that. So having to bring it here for them and empower them with knowledge, then you will see that there really is a change here.
It has been a collaboration right from the start, and that the investigators from Johns Hopkins are very vested in. It's not that they just drop in, they come, they stay. My predecessor was here, I think, for 13 years.
We look forward with working with Johns Hopkins and actually improving our capacity, and also looking at very important public health problems that we face with the hope of finding common solutions.
It's important that people understand that this is an opportunity to have major impact if they can partner with us to support these programs. Major impact by ensuring that some of the best educators, clinical educators in the world at places like Hopkins, can help to train people where that education is needed the most, and do it in ways that are cost-effective, that have major impact, and really do improve the health outcomes in the communities in which they work.
Let Dr. Bartlett maybe introduce himself and some of the folks at Hopkins.
So I'm John Bartlett, and there's a number of people in the audience.
Our group has a lot of experience as well, not only in the use of these technologies, but most of us are engaged in activities in other countries that give us a unique perspective on how to do that. And we really need and are looking for partners to help us increase our programs and improve the scale and impact in which we, in the communities in which we work.